Hello, Las Vegas, and welcome to Healthy Las Vegas. We have a little turn of the tables here today. We normally have Tina Drago, who is interviewing her associates or her referral network. But today, we're coming to you from Studio A, Beasley Studios on Durango, and we're going to be interviewing Tina Drago, who heads up the First Person Care Clinic. And welcome, Tina.
Hello, everybody. Yes, I thought I could get away with this. I figured I could just be the man or woman behind the curtain and interview everybody else. And here you guys, you figured it out.
Yep. We're turning the tables on you. There's just been crazy amounts of great stuff that's been happening with First Person Care Clinic. And
there has been. Yes.
We need to find out what that is. And I just want to find out. Well, first
you have to say pretty please.
Pretty please?
Pretty please, yes.
With sugar on top?
Sugar on top,
something
cherry.
like that?
Works.
Okay.
I'll tell you everything now.
All right, that's what I need to know. I need to know now.
Now, this very second?
This second.
Oh my golly. Okay, so we have we've done a memorandum of understanding and a business agreement with Nevada Hand, which has 30 low-income apartment complexes here in town. 25 for seniors and 5 for families. And when you think of low-income apartment complexes, let's just think about the average person walking down the street who's the working poor. Come on, we all know who they are. We all are the working poor.
I think that's me.
And you want to have something nice. You want to have something safe for your family. You want to have amenities, but you don't necessarily have the money to pay the thousands and thousands of dollars that go along with all those features.
Right.
Well, Nevada Hand is a 24-year-old nonprofit organization that recognized that issue and has come out and said, hey, we are going to provide safe, clean, amiable, with lots of amenity programs. And not only that, they have clubhouses on each property, and they have like a coordinator.
Really?
So they put on events, they put on fairs.
Awesome.
So what we've been doing just in this last week since we've just started our new relationship with them is First Person has gone out to these communities, and we've been doing back to school fairs with them, introducing our services and also giving them an opportunity to have their children immunized, get sports physicals done right there on property. A lot of the working poor are either single parents, or both the parents are working and they don't have time to take off during the week to take their kids, get them immunized and get their sports physicals. And, it's all that ramp up to back to school. And school starts in a week. And some schools have already started.
Right.
So,
yeah, my wife's a teacher and she is back.
She's back.
So you're saying they have 30 campuses.
Yeah.
And you've already began your services on them from a mobile.
Yes, we've been to 4 of them already. Okay. And we go out there and we bring our team of people, and we can do everything because we are such a high-tech clinic.
Right, of course.
And I say that with all due sincerity. We rock when it comes to technology in the clinic. So everything that we have for our medical system is web-based.
Okay.
So we can go on location anywhere, pull up medical records, provide services, and get all that done on location, which gives us a big edge. We're not pulling paper files, and we can actually integrate. We actually do integrate with the state of Nevada's WebIZ program. And so anytime a child...
WebIZ?
WebIZ. And WebIZ is a program that's a state register of all the immunizations that children and adults have had.
Okay.
So if an adult has had a hepatitis B series, it's registered in the state of Nevada with WebIZ. If your children come to the state and you're not sure what they have for immunizations or what they need, the WebIZ program works with the doctor's offices, and we had a show on this where it's the law for the doctors to register the immunizations. So you will know at any time where your child stands as far as what immunizations they need, when they're due for their next immunization. And so we integrate with them. And so when we put our immunizations in our system, it automatically goes to their system. So it's a really cool feature.
And just a question. So parents, and this is maybe a side note, parents who have children who have not been immunized.
Say it again, baby.
Yeah, I'm going to go linoleum. See, I said that.
Linoleum.
Who have not been, help me out here.
Immunized, yeah.
Yeah, exactly. Is it normally that they just, forget what the kid has had, haven't.
Well, there's a few things. One, most pediatricians give you a piece of paper telling you what the kids have. And if you're like most parents, this piece of paper has traveled through the years and it's gone from house to house and it's gone from school to school.
Right. Okay.
And if you've traveled from out of state, well, sometimes those pieces of papers go missing.
Right.
And then you have to start over at square one. And so the registry, when you put it in Nevada is very good in this, and there's not a lot of states that do it, but Nevada is definitely ahead of the curve when it comes to this. When you put it in the registry, you don't have to panic when you lose the piece of paper.
Right.
So, and the parents, you don't have to put it in the registry. It's the doctor's responsibilities. Who's ever giving the shot, even if it's Walgreens, they put it in the registry. So, so you can not have your child's information that way. You lose a little piece of paper. Or we have a lot of people that move here from out of state, from other areas, and they're bringing those records from out of state, and their child needs to be set up then in the registry, and any provider will do that for you, and we at First Person do that all the time for patients.
So they could call you at 702-380-8118?
Yes.
And find out, first of all, where they stand as far as their shots.
Exactly. And we'll also give them access. So we'll give them the website if they want to go in and look around and see also. We don't keep it a secret.
Right.
So parents need to be knowledgeable. So now Nevada has a law that when your child starts kindergarten, they have to be up to date on their vaccinations. And unfortunately, we see too many that are not. And then they end up having to get a lot of shots in a short period of time. And that kind of sucks because it takes away from the positive experience of starting school for the first time.
But physically, I mean, if you're getting that many shots at one time, it's got to have some kind of drag on the body.
And we won't do it all in one day. It just won't happen. We'll do it over a month period. But your child can't start until they're done. Yeah. So this is one of those things. I
can never find my kids' shot records. My wife and I, we were always like, we thought we put in a safe place. But the dog records, always easily readily available.
Where are your priorities?
I don't know. It's crazy. It's so weird.
So if and when you find those shot records, bring them into the clinic, and I'll
24 now. They're on their own. So.
Oh, there you go.
Yeah.
But you know what? Even when they're 21 and 24, do you know when they start college, they have to have their immunizations up to date? And yes.
Huh. Okay.
So my son started college last year. Yes, I'm that old. I know it doesn't sound like it.
You look great, though, Tina. Look at you.
I love it. I set him up for a compliment. So my son starts college last summer, and we took him in, and he needed 5 more shots. Primarily, it's the HPV shot, it's the meningitis shot, it's Tdaps, tetanus shots, things like that. But most likely, you are going to need some form of immunization when they start college.
Yeah, my youngest started last year, and my wife normally takes care of that stuff. She's good that way.
That's why you have a wife, right?
Yeah, exactly.
Exactly.
Because I'd be completely lost on my own, my poor kids, if I didn't. But yeah, I do remember that she was missing. I forgot which one, but she was missing something.
Yeah, and it's usually and certain shots are series. So like HPV is a series of 3. Meningitis, I think, is a series of 2. Tdap is your tetanus shot. Those need to go out every 5 years. So there's always, so we were out there on Nevada Hand doing all this and helping them because these parents, and it was really nice because we sent out the paperwork ahead of time. So the parents could fill out the paperwork, give it back to the community director, and then we could go in there and take care of their kids because they authorized it. So that's one of the things that we've been out there doing.
But you're 100% mobile right now, but the goal is to have you physically on their main property.
So our mobile isn't like we pull up in a big van, open the doors, and we're an exam room. Our mobile is that we have a van that's completely outfitted with a bed and a privacy screen and EKGs and laptops and all that stuff. And we pull it out and we set up kind of a MASH unit.
Gotcha.
So that's our mobile, is like a MASH unit camp that we can go out there and do that because we go to schools. We're a clinic-linked school with or a clinic. Or school-based clinic. No, school-linked clinic.
What
Jeff,
are you saying,
erase
Tina?
all that. We are now a Clark County School District school-linked clinic, which means we have authority now to go on all the school campuses and to do back-to-school fairs and to do sports physicals for them on property on the school. And it's not as easy as it seems. They require a lot to work with Clark County School District.
Think so.
So we just got that approval also this summer. We work very closely with 4 hospitals in the downtown area, UMC, Sunrise, North Vista, and Desert Springs is our latest big hoorah. And
Nice.
we're actually working with them to do two things. One, to help anybody who doesn't have a primary care provider be safely discharged. So when a hospital discharges you, it's their responsibility to make sure that you have a follow-up visit, that you get all your pharmacy items, that if you get any equipment, you need equipment, you get all those things. So a hospital can't just discharge you and say, good luck, take care of it. We got faith in you. It's their responsibility to safely discharge. So we've contracted with them to be their safe discharge point. So within 3 to 7 days, you'll be in our clinic when you get discharged from the hospital, follow-up exam. We have a care coordination team that will make sure that your pharmacies get delivered to you, or you can pick them up.
So you're right out at the house taking care of all this. They do not have to come?
No, they come into the clinic.
They do come into, okay.
They come into the clinic. Our home visits are strictly for non-ambulatory patients. These are bed-bound patients. These aren't patients that go out and play bingo and just don't want to have to come to a doctor's office because it's an inconvenience. When we go out there, they're quadriplegics, they're bed-bound, and we have a limited service for that. And I don't want to emphasize that we do home visit, because the truth of the matter is if you're capable of coming, or you're capable of going to a grocery store, you're capable of going to a specialist doctor's office, you're capable of coming into the clinic.
And if they were to come into the clinic, where would that be located?
1200 South 4th Street, Suite 111. We're located on 4th and Charleston in the Art District downtown, the up-and-coming New Bougie area.
Now, I know exactly where it is, because Tina is not only a business associate and friend of mine, I am also a patient at First Person Care Clinic. And when I was actually, I've been a patient.
So tell us about your experience at First Person.
It was outstanding. It was outstanding. Well, I was comfortable coming in because I knew you at first. But even if I didn't know anybody when I went down there, I was welcomed immediately in the waiting room. It was, the process was easy. But my favorite was not only was all the initial contacts very pleasant and easy, and pretty much I just gave the information and everybody did everything for me. It was limited amount of paperwork I needed to fill out.
Yep.
But when I actually sat with the doctor, Andrea, and she is outstanding. And didn't you tell me she saved somebody's life outside your clinic?
Yes. We had a high and low in July, and we had a patient that had just come from a visit, and she was an elderly patient with many diagnoses, and she was with her son, and she had just finished her office appointment, and she was complaining about abdominal pain. We're
having issues today, aren't we?
We are, blah, blah, blah.
No, okay, I'm going to let it go.
Jeff, you got lots of editing.
Yeah, you do.
So she was complaining of abdominal pain, and her son really thought she was just hungry. And he kind of passed it off. And we find ourselves doing that quite a bit. Mom, dad, grandma, grandpa, they're complaining, and we're like, yeah.
Right.
You just, maybe it's gas, or it's this or it's that. And we really don't put a lot into it. And so he goes, okay, I'll go get you something to eat. So he rolls her out, because she was in a wheelchair, and he's ready to take her to go get something to eat, because he figures that's the reason for her pain. And she collapses and falls out of her wheelchair. Right outside the clinic. So we run out there, and I have to say, in 2 years and a little smidgen, we first time we actually had to break open our crash cart.
Wow.
And so the crash cart did exactly what it was supposed to do, and we revived her, brought her back, and she had lost conscious, stopped breathing. Got her all taken care of, called the ambulance, got her stabilized. They took her to the hospital. She ended up passing. It was a cardio issue. She ended up passing a couple weeks later, but her son called us back. And he was so thankful that he had those extra days to put things in order, to work with her.
If that had happened 5 minutes later, it would have been
done. We wouldn't have been there. And he just thought that he just had a lot of angels helping him.
That's
really get prepared.
Wow.
And I think we all recognize that even though we know somebody's ill or we know somebody's old, we figure, well, they'll still be there tomorrow, or we never really, and especially when it's family or somebody close, you just never really think that they won't be there. So he had a wake up call, and he got things in order. He felt really good when she did pass. He felt like he had done everything she needed.
Right.
and that he
That is,
and it
I
was
mean,
a
it's
positive.
sad, but it's so cool.
It was a positive negative. Is
And
that
I could
you know?
totally see this just based
Yeah.
on the people I met when I first entered the clinic to actually sitting and the time that Andrea spent with me.
Yes.
It was a great experience. So I could, everything you're saying, I wasn't there, but I could totally picture it.
We
because-
have, and I mean, honestly, the best group of people, because I have to say, I'm not an easy boss. I'm
I
a
could see
fair
that.
boss,
I could
but
see
I'm
that, too.
hard because I'm passionate. So if
Right.
I'm passionate, I want my team to be passionate. And the passion's about doing right by everybody in the community. I don't care if you're living in the $1 million lofts or if you're homeless out on the streets. Everybody's treated the same. Everybody's respected the same. People are people. And I expect my patients to treat my staff with respect.
Right.
So, it goes both ways. And I'm really passionate about that. So when I hire people, they either cut the mustard or they don't pretty quickly, because I'll be the first one to roll up my sleeves. So if I'm going to do it as the CEO,
Right.
why wouldn't my team do it?
Right.
But I have to say that the team as a whole, they work very well together. They're a well-oiled machine. They're very family-oriented as far as helping each other out. Nobody says that's not my job or that's not my patient. Everybody just, steps in and takes care of the issue at hand. And
Right.
you really want that culture when it comes to people.
No, and you could feel it when you're in there. It was,
Thanks. I love that.
And I just had the one visit, but and I've been by once or twice just as to just do business,
Yeah.
and it was the same. It didn't matter why I was there. It was just everybody just treats everybody like a person.
Yeah, I have
first person.
a first person. Isn't that nice? We do what we say. We
Right.
say what we do.
So if I'm going to come down to your clinic at 1200 South 4th Street, Suite 111, and I have insurance, what kind of insurance do you take?
We basically take every insurance out there except for HMOs. We only take one HMO. We take HPN HMO and we take Caramore. But we don't take senior
But
dimensions.
you
we
take
don't
every
take Humana.
insurance other than
Yeah.
the HMOs, but the two that you did mention. You do
Yeah,
take.
no Humana, no senior dimension. Unfortunately, but we should take them.
You should take
we
them.
should
and you're
take them.
probably, knowing you're definitely
We're
working
trying
on it.
to take
I would
them.
have no doubt.
Yes.
But what if I didn't have insurance?
If you didn't have insurance, and we have a lot of people that don't have insurance, they're either undocumented, they're new to the country, they're new to the state. There's all kinds of reasons why people don't have insurance. It's really expensive, So we have an income-based sliding fee scale. And our income-based sliding fee scale basically looks at how much income you make, and it adjusts the lab fees and it adjusts the office visit fees so that you can afford them. And if you need time because you may not have that much money, we also have payment plans. The one thing we don't do is we are not a free clinic. So if you come in and say, I have no money, we'll work with you on a small payment plan that works what's ever meaningful for you to pay. But if you come in and say, I don't want to pay you, then we just send you off, because if
Okay.
you don't want to pay for your health care, why should we want to give it to you?
That's fair.
I mean, it sounds like a little
Yeah.
harsh and
No, I mean,
cruel,
it's,
but we're about shared responsibility when it comes
Yeah.
to a person's health. Imagine if we're spending our time, and I've got professionals and I've got very well-trained people that I have to pay.
Right.
And if you don't want to pay for your health care, are you going to listen to them? Are you going to take their advice? There's
And
no
it's
value.
going to be at the expense of everyone else. I mean,
It's
you have to pay
absolutely
your staff.
going to be at the expense of everybody else. I love my staff. My staff is phenomenal. They work and they go above and beyond, but they expect a paycheck.
Right.
So
As they should.
As they should.
Yeah.
Because they are professional. I'm not for being a community health center, we have very, very high quality standards that we deal with and that I expect out of them, because we are looking to be a federally qualified health care center.
And I'm so glad that you said that, because I've seen that term. I've seen it attached with...
FQHC.
Yes. Say it one more time.
FQHC.
I love that.
Yeah.
What is it?
So FQHC is a standard of care, and it's a type of clinic that provides the highest quality of care you can imagine in a community health center. It's so we have reporting and we have visibility and we have standards that are not driven by a third-party entity. They're driven by the federal government. And the federal government wants to see very high standards, high quality. The only thing I can associate it with for the lay people out there in the community is maybe like an ISO 9000 rating for industries, for mechanical industries, or a JCO rating for hospitals and surgical centers.
You're losing me, but
it's a very high quality standard. So you're expected to set policies, and those policies guide the procedures. Those procedures guide the actual outcome of the, or guide the actual process of how you take care of a patient. And that patient's outcome is what determines your success on that policy or not. So the whole point of it is that we are incentivized to make sure our patients have a higher quality of life. We are not incentivized to see a patient every week. The better quality our patients are, the higher level of care that the patients receive and administer and live by, is where we get our pat on the back. So if our patients come in and they have uncontrolled diabetes and uncontrolled hypertension, and we get it under control, we get more incentive. We get higher quality ratings.
Nice. So, and you're how close to...
Oh, I want to say weeks, but I don't want to jinx it. I want to say weeks, but we don't want to jinx it. So let's just say sometime soon.
Sometime soon.
Sometime
coming
soon.
to a theater near you.
Yes.
Gotcha.
Yes, okay. And we have other FQHCs in Las Vegas, and every one of them is a little different, and every one of them addresses their community directly. Our community's downtown. Some of them are on the east side. Some of them are on the north side. So they're designed to be in the community and address the needs of that community.
And as far as the community goes, if you are awarded this FQAC accreditation,
yes.
What does that mean to the community? What does that mean to?
That means that you are getting getting a high quality of quality care.
I just want to make sure, because you were going with the JCO. And,
you're getting every FQHC out there, even though they're designed to help the most vulnerable population, and they truly are designed by the government to help the most vulnerable people in the community. Right. The quality is that of a major VIP concierge doctor, or you're not getting low quality. You're not getting free clinic quality. You're not.
So what's going to be the difference? Because you already give that quality at First Person Care Clinic.
The only difference is going to be that I get recognized. That's the only difference.
It's like, okay,
I want my badge.
Yeah. Because you've been doing this.
We've been doing it
ongoing.
Yes.
You could have been an FQHC.
Oh, a year ago. We honestly have set those standards.
Yeah,
we meet those standards. We've been performing those standards. This is just a recognition, and it's super, super detailed. I mean, I'm glossing over it, but there's like 125 pages of actual like details in order to have that standard. It's not an easy standard. And to be perfectly honest, even the FQHCs, once they've been credentialed, it's an ongoing struggle to keep those standards up and to meet them. And each site location has to have more. And it's an ongoing struggle. So when you are dealing with an FQHC, know that you are getting the highest quality care available.
Okay. Well, Tina, you have one more minute. I love this, where you're on the other side, and
I know I feel
one
awkward.
More minute to say anything you want to about First Person Care Clinic. What is it in 1 minute that the public really needs to take away from this?
I think the public needs to truly understand that when you come to First Person Care Clinic, you are dealing, even though it's downtown and it's in kind of a transitional area, you are dealing with the highest quality of care available to an individual. We'll treat you with respect, and we will do what we can do to help you get the quality of life that you so deserve. And that we're looking to have more of these clinics throughout the community. And we've been talking with various people around Clark County, and we're going to be here for a while, and we're going to be changing the way healthcare is viewed in Nevada. That is my goal, is that when people think about Nevada, they're going to think our quality of care of healthcare is higher, because these standards are going to be all over the place, and not just by me. They're going to be by other FQHCs as well. And
I totally believe that goal will be reached.
I have a 5-year goal. That's a 5-year goal.
That's a 5-year goal?
That Nevada's,
how far into it are you?
We're 2 years into it.
2 years into it.
So my 5-year goal is that Nevada's healthcare is going to be in the top, say 10 in the country. And then after that, we're going to be on Capitol Hill telling them how we do it.
Nice.
That's-
and you'll
that's
be
the
there
goal.
leading the whole march up there.
Oh yeah, I'll be
I
like
have no
yakety yak yak yak.
Yeah.
You can't stop me from
Well, I'm
talking.
hearing first person. I don't even know why, but I'm hearing. I mean, you have the one clinic that's
Mm-hmm.
down there, and I know that you're reaching out and helping hand and helping hand.
Nevada Hand.
Nevada Hand. Sorry.
Nevada Hand.
But I'm hearing first person care clinic everywhere. I don't know why that is. Is it just? I know you have your
We're
fingernail on
involved
things,
in a lot of different organizations. We are involved with the county. We're involved with the city. We're involved with North Las Vegas. We're involved with the health district. We're partnering with the health district. You know, we're doing. We're out there in all these different areas. In fact, after this, I'm going to a Boys and Girls Club meeting to be a clinic at a Boys and Girls Club.
Look
So
at you go.
you know, we're working with the
When
big
do you
dogs.
sleep? How many hours a night? Give me.
Honestly?
how many hours a night?
3 to 4.
Really?
Yeah.
I could see that.
I'm a hyper diaper.
Well, Tina, I could totally see that.
Yeah.
Unfortunately, our time has come to an end here on Healthy Las
bummer.
Vegas. I want to thank you for
Thank
being
you.
on your own show and allowing me to have the time to chat with the awesome things that are happening.
Mark,
first person.
who are you?
Who am I?
Yeah, who are you?
Well, we're out of time at this point, so you know what? We're going to save that for another show. But I do want to thank you for sharing
Thank you very much.
with Las Vegas and with me the awesome things you guys are doing. I want to thank the Las Vegas community for listening in today to Healthy Las Vegas, coming to you from Studio A, Beasley Studios. Have a great day.